Patience of Reddit. What made you say how the hell is this person a doctor? I had a urinary tract infection. I'm a male, and I made an appointment with my local GP who was a female. I described my symptoms and said it felt like a UT, to which she replied, you can't have a UT, men don't get them cause men don't have urinary tracts clearly. So I made another appointment, had the necessary tests done, lo and behold I had a UT and was given a prescription of antibiotics. A week before my baby was due, the doctor, not my regular doctor, but a doctor nonetheless, decided to do an ultrasound because she couldn't feel where the baby's head was. Then she asked me if the baby had legs. I said yes, legs and feet. We had seen them on the 20-week ultrasound. She said, well, I don't see them, so I don't think this baby has any legs. I knew that my baby's legs didn't just fall off in there, and said exactly that to the doctor, or I would freaked out. The reason for this was that my baby was breech and facing into me instead of out towards the doctor, so her legs were tucked up under her body. My regular doctor said it was a common mistake, but I really don't think so. I have been dealing with tonsil stones since I was 10. My mom took me to so many offices trying to get someone to take my tonsils out. They continued to refuse, saying I was too old. It continued to get worse as I got older. My tonsils became misshapen, swollen, lumpy, red, and extremely painful. I had to go have multiple tonsil stones removed by a doctor because they were so large. Last time I went in I was 18. At this point I was just begging for them to be ripped out. Once it was denied again, I asked if there was anything I can do that would make them a little better or the pain less intense. I've tried everything at this point, but I'm desperate. The doctor stood up, sighed, and told me, I can't help you. Living through extreme pain is just part of life. No one can fix this for you, so stop over exaggerating and deal with it. She left the room immediately after. As is the story for many women with endometriosis, I went years without having a doctor take me seriously, and every couple of months during my teens my mum would hit another no, this really isn't normal patch, and take me to see a different doctor. The absolute highlight was a doctor at a walk-in clinic who had obviously attended a talk on depression. The consult went like this. The cramps are unbearable. I can't walk. Most months I vomit from the pain. It's in my back and my legs, not just my stomach. I can't eat. Ovulating also hurts so much. I can feel it. Do you do any extracurricular activities at school? Yeah. I play the cello in the school orchestra. Do you play your cello when you have your period? No. I can barely sit up. Do you go out with your friends when you have your period? No. I can't go anywhere. Do you call them? No. I'm in too much pain. I think you have depression. Withdrawal from friends and social activities are classic signs. Kudos to her for taking an interest in mental health, but that's not the problem I came in with. I eventually got a diagnosis at age 22. I first started seeking medical attention for it at 11. I had a back problem, and when I was at the doctor's letting him do his thing with my spine, I turned round to see he had Google image searched spine and was reading off the screen to tell me where I was hurt and why. I got prescribed pain meds, and he literally said, is 100 enough? Would you rather 200? He also had to sign me off work for a while, and his exact words were, so, a month, or should we say 2? Came to my doc with an eating problem. Guy looked in my file and saw I was seeing a therapist. Said then there's no reason to see him. Turned out I had a serious medical condition impacting a lot more than eating. After treating it, didn't need to see a therapist. Thank God I know to take everything medical pros say with a very big grain of salt. Went to the GP for some antibiotics for her infection. Standard stuff. Tell her I'm allergic to some antibiotics. Doctor gets annoyed because the one she wants to give me is one I'm allergic to. Starts questioning my severity to the antibiotic and wants to prescribe it to me anyway. I obviously refuse and name some that I have been on before. Go the chemist to get the subscription, and she has listed a different obscure name for the antibiotic she wanted to put me on. Wouldn't you know, I have a allergic reaction at work. Called the practice and told them she fucked up. As a pharmacy tech, I see a lot of stuff that just hurts the head that the patient never even knows about. One of the worst I've seen was an antibiotic for a 60-something man. The antibiotic in question can have a potentially fatal interaction with this patient's cholesterol med. So my pharmacist called the doctor about it. 4 phone calls and a half-hour argument later, the pharmacist just flat out refused to fill it. You know, because he found knowingly giving someone pills that would likely kill them objectionable. Crazy, right? The patient came in looking for this antibiotic. The pharmacist talked with him and explained the whole situation and why it wasn't filled. The patient then apparently went to the doctor's office and ripped him a new one. An hour later we had a new recipe for a different antibiotic for this patient. When my sister was dating her now husband, he developed this rash that wouldn't go away. They went to an urgent care and the doctor there told him it was bug bites, gave him a steroid injection and a prescription for steroids. My sister wasn't convinced and told him that they should have my mom, a pediatric surgical nurse, take a look. My now brother-in-law walks in, and before he can take off his shirt or say anything, my mom says, "Wow, looks like someone has chicken pox." She could see a few of the bumps on his neck. They get him into another doctor and sure enough, he had chicken pox. The new doc was not happy to learn about the steroid injection and prescription. Steroids suppress the immune system, the last thing you want for a virus. Told Bill not to fill it, and if it got worse they would call in an antiviral. Obligatory not me, but my mother. She had breast cancer and wanted to remove her breasts entirely. The doctor decided it was best to remove the tumor, but for some reason left a gaping fucking hole in her chest. My mom kept trying to tell him she was afraid of infection, but the doctor reassured her she would not be. She ended up getting an infection, and it was horrible. I got an ECG done to determine whether I had Wolff-Parkinson's White syndrome or not. My doctor called me on a Friday and left a message saying, "So it turns out you have that thing," and proceeded to tell me that she would be back in the office Tuesday if I had any questions. I proceeded to have a series of panic attacks throughout that weekend. As a first-time mom, I took my newborn into a pediatrician's office that has multiple doctors. My son had acid reflux, but the doctor said he was throwing up because I fed him too much. He told me exactly how much to feed him. A week or so later I take him back in because he is crying all the time. Happened to get a different doctor this time. Doc asks me how much I feed him. I told him. He stands up, pats me on the shoulder, and says I'm not feeding him enough. He has his hand on the doorknob, and I said the first doctor told me to feed him that much. Doctor literally shrugged his shoulders and walked out. I sat in the room and cried because I felt so lost and like no one would help me. Being a first-time parent sucks sometimes. When I was in college I would get the worst stomach aches. I went in many times over a 3-year period and the doc kept giving me acid reflux meds. Looking back, he never looked at my chart. He was a former doctor. Finally got an appointment with a PA. She looks at my history, says, "Why is he giving you medicine for the same thing?" I will never forget the look of horror and empathy on her face. She got me to the right specialists and found out I had a chronic stomach issue. When I get frustrated with doctors, I remember her and how much she cared. I waited weeks to see a doctor that I'd never been to before. I waited there forever to be looked at for a minute. I tried to explain the reason why I was there, but she just kept saying nope, you're fine, and actually walked out the door on me in mid-sentence without addressing my issue. I had to take more time off work to see my regular doctor, who was horrified I'd been treated that way and actually prescribed me medication to treat my problem. When I was pregnant with my son I had hyperemesis gravidarium and puked violently every day till he was born. But at 12 weeks I was admitted for 2 weeks. On every med they had to stop the puking, including 24/7 IV bag with gravel infused. Even needed a couple steroid treatments. So on discharge day after the steroids, still puking but not as bad, my pregnant obgyn tells me I should start using pregnancy drops at home, and they should help better than the meds. Like, how the fuck is candy gonna help when steroids just barely worked? My mum got a repetitive strain injury in her shoulder for making blinds for windows by hand 4 years in a factory. Essie always had to reach above her head to do things, causing her to have problems with movement in his shoulder. She goes to the doctor and says it hurts. When I do this, lifts her arm. Doctor then don't. When my mum told me that, I wanted to haymaker that doctor. What an asshole. For some reason, When I was about 7 or 8 I had to get my blood drawn. I went to an outside lab to have it done. Naturally I was nervous because, ick now, needles. My mother, before her narcissism really kicked in, was told to wait outside and brought me in. I sat in the chair and got even more nervous. The needle got closer and I flipped the fuck out. I squirmed, screamed, cried. It took 5 doctors to hold me down, and none of them even attempted to calm me down. Eventually my mother took me, stormed out, and we never went back to that lab company again. Well, she did. Anyway, I get my blood drawn at my doctor's and ask for a butterfly needle and I have lidocaine to spread on my skin. Much less painful experience. Last weekend I went to the doctor because I was constantly nauseous. After a general examination, the doctor told me I might have sinusitis, which I confirmed. I told her I was diagnosed with chronic sinusitis about a year ago and was therefore nausea. Well, she spent the entire time telling me to get a billion tests done for sinusitis and promptly shooed me out her office. I still don't know why I'm nauseous all the time. I thought doctors were supposed to listen to the patients.